favorite part of the brain is the amygdala, which is a paired structure, meaning it is in both hemispheres, located anteriorly to the hippocampus in the medial temporal lobe, and it is green in this image. First, we're going to look at the functions of the amygdala. The amygdala is part of the limbic system and plays a very important role in emotional learning and behavior. It helps form feelings of happiness to sadness and from feeling safe to being frightened. Most of these feelings will contain what is called a valence, or how positive or negative that feeling is, and an intensity. To study the impact of the amygdala on these factors, psychologists Heinrich Kluver and neurosurgeon Paul C. Bucy studied monkeys who had lesions in their temporal lobe, which included the amygdala. The amygdala plays an important role in both innate and learned emotional behaviors. In innate emotional behaviors, the amygdala receives input from the insula, hippocampus, and rhinal or olfactory cortices. Due to this olfactory input, pheromones and other appetitive or aversive stimuli can produce expressions of emotional state, which the cortical medial amygdala is known to mediate. For other stimuli, like drugs often abused, the basolateral complex likely contributes to the responses. For learned emotional behavior, this is most often studied using Pavlovian conditioning methods. During this form of learning, the response of the neurons in the amygdala to these conditioned stimuli change. Continuing from that, the neurons in the basolateral amygdala are activated during induced learning. After this induced learning, activation of these same neurons to the central nucleus of the amygdala are implicated in forming psychological and behavioral emotional states. The most famous function of the amygdala in these cases is that it plays a heavy influence on fear processing. However, there's also been a large amount of evidence that it also plays a role in the process of rewarding stimuli. The activation of neurons in response to the rewarding stimuli can produce Pavlovian learning and follow a pathway from the amygdala to the ventral striatum. Next, I want to talk about dysfunctions of the amygdala. This is where the amygdala becomes my favorite structure of the brain just because of how different each can present depending on how and where you hurt the amygdala. First, we're going to talk about Urbach-Withi syndrome, which is a rare autosomal recessive disorder that predisposes the individual to increase collagen deposition in the skin and soft tissue. Urbach-Withi causes cosmetic symptoms, including waxy papules on the face and eyelids, hyperkeratotic plaques over sites of frequent trauma, and ankyloglossia, or the inability to stick out the tongue due to plaques on the tongue. However, due to the destruction of the amygdala, the patient also does not have any conscious perception of fear. This is especially noticeable in a patient case known as SM. SM was a person who had complete destruction of their amygdala, and they would reach for a poisonous snake, calmly walk away from a man wielding a knife, and would laugh in haunted houses. Through SM and the destruction of her amygdala in Urbach-Withi, the evidence that the amygdala plays a role in the fear response is strongly increased. The next dysfunction of the amygdala that I want to talk about occurs during Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disease that produces many neuropsychiatric symptoms such as hallucinations, delusions, paranoia, and anxiety. The damage to the amygdala occurs very early in Alzheimer's disease development and includes the shrinking, distortion and loss of neurons, and widespread gliosis. Patients will develop neurofibrillar tangles, Lewy bodies, which are an abnormal accumulation of proteins, and amyloid beta plaques in their neurons, which leads to their atrophy. Another key symptom is that the impairment of emotional memory. Through studying both healthy individuals and individuals with Alzheimer's disease who have varying degrees of amygdala damage, it has been found that the impairment of emotional memory worsens as the atrophy to the amygdala gets more and more severe. Because of how many roles the amygdala plays in our body and how differently it can present when it's atrophied or damaged, the amygdala is one of my favorite parts of the human brain.